All right, thanks so much for coming back together. I'm Abby Cole. I'm with the Washington State Healthcare Authority. We are the administrator of the GEMT program. We are the Washington State Medicaid agency. And I am going to pass the mic over to Shauna Pinn. She is your GEMT program manager. So she lives, breathes, sleeps GEMT. So Shauna is going to take over from here.
Good morning. Well, I don't need to tell you who I am because you already know. So I'm just going to go ahead and switch to the next slide. This slide, just so you know, I'm not going to read everything to you. I know you guys can read, so I'm not even going to insult you that way. So here is just a summary of what this slide is. It's a high-level summary of the topics that I'll be discussing in my presentation. And as we complete each slide, if you have any questions, please feel free to raise your hand so that we can address them at that time. Okay? So this next slide is just basically the who's who of HCA. As I previously stated, or as Abby stated actually, I am the GEMT program manager and I will be your primary point of contact for GEMT. I work very closely with Abby as well as our section manager, who is Jean Bowie, and I believe she's in the back as well. And it's not my endeavor to be before you long, so I will go ahead and get started by telling you some of the things that I will be responsible for and what you may want to be contacting me about. I will be completing the initial review of your cost reports and participation agreement that you submit every year. And I will also be the one who's going to communicate with you as to whether or not those documents were accepted or rejected and why. I will also be enrolling new GEMT providers as they pop up and decide this is something that they really want to do. I'm also going to take the cost reports that you send to me, and I will be establishing your interim rates. I also perform the final reconciliations and the settlements based on your second cost report that you submit. And I will be sending you the data reports so that you guys can complete your cost reports every year. That will be done prior to the due dates. Do we have any questions so far? All right. During the 2015 legislative session, House Bill 2007 was passed, as we've heard throughout the morning. And this House bill basically authorized ground emergency medical transportation providers to participate in a newly established supplemental payment program. This is completely a voluntary program, and it is my hope that something that is said here today will increase your willingness to participate in the program. I want to make sure that you know that if you opt not to participate in the program, that you will continue to be paid at fee schedule. So what the current posted rates, Medicaid rates are for ambulance transports. Our state plan was approved by CMS as of July 1st of this year. And our SPA was written and submitted to CMS by my predecessor, who is Vesna, and I'm sure some of you probably worked with her prior to this. So what deems you an eligible or qualified GEMT provider? In order to be considered a qualified GEMT provider, a provider must meet all of the following criteria. First, you must be an entity that is publicly owned or operated. Second, you must have a current Medicaid core provider agreement with the Washington State Healthcare Authority. And lastly, you must be providing GEMT services to Medicaid enrollees. If you are an entity that has a contract with another provider, i.e. one of you in the region will perform the ALS transports, another one will perform the BLS. If both of those entities are publicly owned or operated, then they would be submitting cost reports, both of them, for the services that they rendered. I also want to mention that the core provider agreement with Healthcare Authority is not something that you guys are going to have to do every year. Once you establish it with us, that's fine. You'll just be responsible to do the participation agreement that's part of the cost report and certify all of the figures and the information that you put into the cost report is true and accurate to the best of your knowledge. To enroll in the program, providers must ensure that their CPA is active with the Healthcare Authority by contacting Provider Relations. If you guys do not have that number, please feel free to contact me at the information that I provided in the slide before, and I will make sure that you have that contact information. You'll also be responsible for completing the annual participation agreement and the cost report. I want to make sure that you are aware that both of these documents will be on the GEMT website. And that address will be provided at the very final slide of this presentation as well. As another stipulation to participating in the program, each provider must agree to reimburse Healthcare Authority's administrative costs associated with the implementation and the maintenance of this program. For the first year, the submission dates are going to be a little different. Normally, it would be November 30th of every year is when your participation agreement and your cost report is due. But because this so late in the game, trying to get things off the ground, the due date for the first year will actually be March 31st of 2018. Just to go back just 1 second, I want to kind of go over these couple of little bullets here. So the first year, like I said, is going to be different. So the participation agreement won't come in with the cost report. We're asking that it comes in on January 31st so that we get an idea of which of you want to participate. Once we have an idea of who that is, then we can go ahead and pull the data reports to send to you guys so that you guys can complete your cost reports. And then, of course, the cost reports will be due on March 31st. So this slide represents a high-level overview of the cost reporting process. This is simply the cost report submission process. It does not address payments. That's something that I will address in a few slides. So step number 1, as you can see, you're going to get all the documents off of our GEMT website, most current version, and you're going to complete the spreadsheet. That's what it is. You'll print out the participation agreement and the certification page. You'll be responsible for signing that and scanning that back to us with the spreadsheet so that we have all of the required signatures and supporting documentation that goes along with it. And then lastly, once we get them, or once I get them, I will be reviewing them for completeness. And then again, I'll be notifying you guys if I'm missing something, I need supporting documentation to substantiate a figure that you put in the cost report or anything along those lines. If I let you know that the cost report has been rejected for any reason, again, I'll let you know what that is. You have 30 days to respond. If you guys do not let us, respond and get that required information to us in 30 days, then again, you would revert right back to being paid at fee schedule. Do we have any questions so far? Yes, sir.
On the previous slide, it says that we will agree to reimburse the HCA's administrative costs.
Yes.
Any idea what those costs are or how they'll be calculated?
And there's actually a slide in the presentation later, so I'll go over that in more detail.
Perfect.
You just give me a little bit and I'll get there. So your interim cost report, which would be your first one that's due, like I said, March 31st, will be used to set your interim rates for the upcoming state fiscal year. The final cost reports we'll use for your settlement and reconciliation process. This will allow for more complete cost reporting information to compare against final paids, because we're looking for the actuals. If again, you guys, I know some of you have audited financials, and that's what you'll base your actuals on. I understand that not all of you are audited on a regular basis like that. And so in those cases, then you would basically be recertifying that what you originally submitted is correct, hasn't changed any as far as you know, and you'd be resubmitting the report. Otherwise, if you do have audited state financials, then you would make the necessary adjustments and resubmit your cost report. There'll be more on the reconciliation and settlement process also. Do we have any questions so far?
Tanya?
Oh.
I just wanted to clarify on slide 7 where it says fiscal year 16 for the state. That's July 1 of 15 through June 30 of 16, correct?
Thank you, Tanya.
And so
Yes,
on?
it is.
Okay, just making
Yes.
sure, thanks.
We operate on the state fiscal year, which is July 1st of one year to June 30th of the next year. I understand that your state fiscal year is not always the same as ours, and so if there's any issues with that, please feel free to contact us, and we can try to work together with each individual person to see what works best for you and what we need to do to make sure the program works best for you. So this slide here is actually some of the frequent cost report errors that were determined in California. As you know, because our program is just now getting up and running, we don't know what those errors may be for Washington, but it is my intention to keep track of that so that I can better serve you guys with that information that we gain. So just to kind of go over some of these so you have an unfair advantage compared to other states would be to let you know what California has stated that they found. So page 1, which is the certification and participation page, is missing the signature. If we don't have those signatures, then ultimately we cannot accept the cost report. And so that's something that we found, or they found. Incorrect claiming periods, again, for us, it's July 1st of one year to June 30th of the next year. Yours may be different, and so you may be filling it out based on what you're used to. That's a common error that's dictated or found. The core provider agreement that's on file may have been terminated or deemed inactive for whatever reason, and the provider is not aware of that. So again, I'm encouraging all of you guys who intend to participate in the program to contact HCA's Provider Relations Department to find out if, in fact, your CPA is active and current. The cost report is not complete. It's missing pages and or the supporting documentation is not submitted. I said in our presentation in Everett, and some of you guys were there yesterday, some of you guys were not, so I'll repeat it again. We would rather you put zeros in the fields if it doesn't apply than to leave it blank. So we are not assuming that you missed that page. I want to know that you actually acknowledged it and that it doesn't apply to you. There's also a notes page, which they'll go over this afternoon as part of the cost report. And so even if you want to put a note on there saying that the shared costs don't apply because we're strictly an EMS provider, then that lets me know you didn't miss that shared cost page, that it just does not apply. Do we have any questions here? All right. Check figures. So this is part of the first page that we've been talking about throughout this presentation. And I want to stress that this is very important and that it is the provider's responsibility. You guys are on the front line, you're doing the work. I'm not out there with you, so I cannot tell you what is true, what is not true, what's the norm, what's an anomaly. So I'm really relying on you guys to give me that correct, thorough information so that I can set your rates appropriately and get that information in the system so that you guys can be paid. And I'm sure that's what you all want. I also want to stress that this is a legal document, so under no circumstances can anyone at HCA alter, add, just because I may know you, I work with you on a regular basis, talk to you every day. Can't fill in the blank just because I know. I'm relying on you guys to take care of that. Do we have any questions regarding? Yes, ma'am. He's coming with the mic.
I don't like mics. My understanding of this program is it took effect when Governor Inslee signed it.
That is correct.
So our first cost report will be based on current numbers, correct?
No, it will go, it's going back. So the actual effective date is June 2nd of 2016 was the effective date. And so the cost reports that you are going to be submitting will be based on that time, but we will be setting rates for an upcoming year. And I'll address that even further in a couple of slides.
Okay, thank you.
No problem. Any other questions? So throughout the day, you may hear, or you may have read in your handouts, the term base year. So I wanted to define that before I go any further. The base year means the 12-month CMS-approved report year that ended immediately preceding the year in which the GEMT interim rate being set begins. I know it's kind of confusing, but I'm going to go into it a little bit further. Payments are based on actual costs to perform these transports. So as I was talking to the lady just a moment ago, the cost reports that you're going to be submitting for March will be for fiscal year 16 and fiscal year 17. So it's old information, but we're using that to set fiscal year 18 and 19's rates. We'll also be using those reports to settle those years in the near future as well. And just to also let you guys know that each cost per transport will vary between you two, or all of you providers, not two, depending upon the information that you guys submit. So this breaks down kind of how we're going to calculate the average cost per transport. It's not a slide to tell you how to fill in the boxes. This is just telling you how HCA calculates each provider's average cost per transport. So you're going to fill out, you see the upper portion based on what services you render during the service period. And then in the second half, you're going to tell us basically how many transports that you provided. And then we'll take the total from the top, divided by the total from the bottom, and that will come up with our average cost per transport. So kind of to tell you the number of transports and explain to you what Washington State is looking for. The first column is managed care. So any managed care enrollee that you transport, you would log there in that first column. The second one is Medicare and Medicaid. So those are our dual eligibles, where Medicare is their primary. Third column is just fee-for-service, so straight Medicaid enrollees would be located in the third column. And the very last column is other, it's the catch-all. So that's private insurance, maybe it's a motor vehicle accident, so it's American Family, some other TPL type. And we'll take the sum total of all of those, divide it by what information you provided in the top portion, and again, that's where you'll get the average cost per transport. Any questions on? Yes, ma'am.
Sorry, I'm that person. So the Medicaid, Medicare combined, you said where Medicaid is the primary?
No, Medicare.
Medicare is the
Yeah,
primary.
Medicaid is always going to be the payer of last resort.
Thank you.
No problem. Any other questions on this slide? Oh.
Question regarding that. So does that mean if their Medicaid is secondary, you're still going to get reimbursement for those types of claims when Medicare was primary?
Yes, we're going to take into consideration the TPL just kind of how we do now. And so if it's not over, it doesn't exceed the allowable amount, and take into consideration all the figures, then yes, you would. Am I missing anything, Abby? Just want to make sure about that. She was asking if they had dual eligibility, how we would take into consideration any payments that the primary had already. So I wanted to make sure I was
And I think they go through that with the cost reports, but it is considered a source of revenue.
Correct.
Any other payments.
Did you hear her?
I don't know what she is. Like right now for Medicaid as a secondary, there's no payment because Medicare's already paid more than what they would have allowed.
Correct.
So if Medicare still is paid more than they allow, there wouldn't be any reimbursement. There's a possibility it could be reimbursed.
But what she was saying is that you would record Medicare's information, the payment information, as a source of revenue on your cost report, and so it would still be part of the calculations. You would still want to submit that claim to us because you might still be eligible for the variance between the two.
Thank you.
No problem. Any other questions? Okay. Now we get to the fun part. So providers are actually going to submit their claims through the Provider One system as they, maybe not everyone is using Provider One. So you're going to submit them the way you normally submit them. The only difference will be you'll be submitting another procedure code, another line item. So if you're doing just the transport and the mileage, you would have your 428, 429, or whatever, and then 425 for your mileage, but then you're also going to be submitting the third line of A0999. This is going to represent each individual provider's average cost per transport based on your cost report and the data that we send to all of you guys before the next period starts. Make sure that you guys, when you're submitting your claims, that you don't put 0 there. We want you to actually put in what we've told you is your average cost per transport. If you do put a 0, then you're going to get a cap, and again, you're not going to get paid that supplemental payment that you're actually eligible for. We mentioned in a couple slides before about the managed care transports. So I'm sure some of you have probably heard, but effective January 1st of 2018, the state of Washington is completely carving out ambulance services from managed care. So all of them will be paid fee for service. We are currently working with CMS to try to figure out what's the best course of action for reconciling back to 2016 for those claims that were managed care. So that will have more to come as far as that's concerned. But going forward, it is going to be all fee for service, so there shouldn't be any issues with regards to that. We want to let you know that if there are any other changes in addition to the contract being changed, you will be able to find that information on our website. It will be reflected in our billing instructions that are also going to be on the website, if not already. I think actually they are. And I'm always available to ask questions. Please don't hesitate to reach out if you need to. Kind of wanted to let you guys know too, because I know this is probably the most important thing to you guys. When are you getting paid? And so the answer to that question is these payments will be real time. So when you submit your claim, just like we send you your remittance advice with your payment, that extra line will be on that same remittance advice at that same exact time. Do we have any questions along the lines of billing, claims, and when you're going to get your payment?
When you have Medicare automatic crosses over to Medicaid, how does that work?
Well, you're still going to want to use that crossover information for filling out, completing your cost report, because those are expenses. But
you say we bill over the AO 999 with that number you give us, but when is an automatic crossover? Does that?
oh, so you're saying you're not going to see it. It's going to come directly to us from Medicare.
Right.
You know, I'm not really sure exactly how that is going to play out. I will have to get with our systems people to see how that's going to look. Maybe you and I can connect after the presentation so I can get your contact information and I make sure I relay that information back to you.
Okay.
Speaking on that as well, I want to make sure that all of you guys are signed up for provider alerts with the Healthcare Authority. Is that anybody not signed up? Good. So again, situations like this, if we find we don't have the answer, and with it being a new program, chances are we may not, I would like to be able to follow up and report back to you guys what our findings are, and I usually will do that via a provider alert. And so if you're signed up, you're going to get that. If you're not signed up, then you're going to rely on word of mouth from someone else. I'd rather you hear it from me though. Any other questions? So this just goes into a little bit more detail, gives you some examples with actual coding. Again, it's an example only. So the providers are going to submit the 3 lines, the AO425 for the mileage. They're not going to submit it for the amount, the allowable amount that HCA allows. You're going to put in what you normally do, your usual and customary. You're going to do the same thing for your actual transport code. And then the AO 999 would be your average cost per transport, and you're going to put that in because you'll know that going into the new service period as well. And then the way we calculate it is we'll take the average cost per transport, and I think Scott's presentation kind of briefly touched on this. We'll deduct the Medicaid allowable amount to determine what the variance is. That variance will be multiplied by the appropriate FMAP percentage, and then we'll add back in the Medicaid allowable amount to give you that federal share of the supplemental payment. Does anyone have any questions regarding how we are going to? Yes, sir.
If I understood you correctly, you said there's an allowable amount for mileage?
Yes.
Is that, I mean,
That's not what you're going to bill. So for example, Washington State Medicaid's allowable amount for mileage is $5.08. You may bill $15, but you're going to get paid $5.08 per mile.
Okay.
So now and then the variance, again, would be applied to the appropriate FMAP percentage, and you would receive the federal share of that supplemental payment to kind of bridge that gap between what you're currently being paid and what it costs to actually perform these services. Any other questions? So here are some payment examples of how that will look. I've divided it into two, one for non-ACA and one for ACA. So ACA, Affordable Care Act, also known as Obamacare. So for the sake of the example, I have said that the provider's average cost per transport is $1,500. We'll say that the transport in this example was for 10 miles. So you'll see that the average cost per transport, we're going to take out the $50.80 for the mileage. We're going to take out the $115.34, which is the allowable rate for a basic life support transport, and we'll get your variance. That's what the AO42, or the variance represents the difference between the actual cost per transport and the allowable amount. Then we'll take that variance, we'll apply it or multiply it by the appropriate FMAP percentage, and then we'll add back in what is actually allowed to you to begin with. So in the case of a non-ACA person, the total amount paid to a provider in this scenario would be $833.07. But in an ACA scenario, their FMAP percentage is 95%, so you can see that in that case, they're actually getting $1433.31 paid for that particular transport. Do we have any questions? Okay. So the final settlement and cost and reconciliation process will be starting approximately 2 years after the close of each state fiscal year. I will be conducting those. Again, I will be getting the data out to you guys. We will have your updated cost reports submitted to us. That will be for your final cost report. And we will see those actuals and make a determination as to if you were paid appropriately throughout the service period. So if a provider was paid more than their average cost or their cost per transport, then that excess will be refunded basically to HCA as a pass-through so that we can give those funds back to the feds. And if a provider was underpaid, it's determined based on your actuals, then I will be submitting to you guys an additional supplemental payment to make sure that you are paid your costs. Any questions regarding? Okay. So again, I'm not going to read all these bullets to you. This slide has a whole lot of information on it. So what I will do is I will kind of just go over your responsibilities and how that feeds in. So each provider will use the data that I send to you guys before the upcoming period to do the required task, and that would be to complete your cost report with your own provider-specific data. You'll be responsible for making sure you sign all of the appropriate pages, submitting that back to me via email with the spreadsheet and the signatures on it. And then you will be also responsible to pay back any excess if it's determined during that reconciliation process, as well as HCA's administrative costs that you agreed to pay when you signed up for the program. Again, we'll go over the administrative costs a little more in depth shortly. Do we have any questions regarding provider responsibilities with regards to the settlement? Okay. So this is just some dates. Wanted to make sure you guys kind of knew. I created the picture so you know what this is going to look like. So our fiscal year generally ends June 30th. By September 30th of every year, I will send your data to you guys so that you can get your cost reports back to me by November 30th. I will use the cost reports after review to establish your interim rates, and that will be around February. I'll send your preliminary letter to you guys about mid-July. That will let you know, based on the information you submitted, June, not July. That will let you know what we determined based on the information you submitted. If you have any questions or concerns, that would be your time to contact us in that 2-week period, because the effective date for that rate will be July 1st of that year. And on July 1st, the actual effective date, I will be sending final letters to you guys to let you know, didn't hear back, doesn't seem to be any issues, this is what's posted and this is what is for this upcoming service period. Do we have any questions regarding the timeline? Yes, ma'am, in the back.
So each year you're going to review them, we have to do the reports, and you're gonna go over again, and it might change.
That is correct.
Our report.
That is correct.
Okay, thanks.
So in case anyone else didn't hear, she was asking if you guys were going to submit the reports every year and if ultimately your rate could potentially change based on the new data, and that is correct. You may have more staff, you may have less staff, you may have more supplies. The cost of supplies went up. It could change from one month to the next, so but based on the year, that's how we're going to determine your interim rate. Any other questions? Okay. So again, I wanted to make sure that you guys are aware that normally the due date for the cost reports and participation agreement would be November 30th. But for this year, this first go round, it will actually be January 31st for the participation agreement, so I can get you your data, and March 31st of 2018 for the actual cost report. That will be based on state fiscal year 16 and 17 data. And just to kind of tell you how that's going to be used, the bottom two bullets will let you know. So the state fiscal year 16 report will cover the service period of June 2nd, 2016 to June 30th, 2016, since that's the end of our state fiscal year. And that will set the interim rate for the last few months of fiscal year 18, which is July 1st, 2017 to June 30th, 2018. The state fiscal year 17 cost report will be used to set your interim rate for fiscal year 19, which is July 1st, 2018 to June 30th, 2019. Did this answer your question? Yes.
I'm still confused on the start date. I thought it would be April 29th of 2015.
No, even though that's when the bill passed, it was not approved by the feds, and since this is the federal share, we have to go by their date. And so even though they approved it as of July of 2017, they did it retroactive back to, I believe, of 2016. That's as far back as they went. Any other questions?
You have the data here from, you used one.
Hang on, wait.
I'm gonna keep back his job. The second bullet, you say fiscal year 2016 cost report will be used to settle the costs for a month period of time, actually 29 days period
Correct.
of time. Is that correct? You're going to use just a month's period of time to set the costs for this coming for the next year?
No, we're going to look at the full report, but it's based because it's only approved for that period. So it's basically going to be prorated for that one or 29 days. Any other questions? Okay. So kind of wanted to go over the FMAP a little bit more. As we talked about a few slides back, the ACA versus non-ACA. So the non-ACA would be those who were already on Medicaid prior to the implementation of Obamacare. The ACA would be those newly eligible based on the implementation of Obamacare. And so again, the calendar year 2018 non-ACA FMAP rate is 50%. But you can see with on the bullets here for the ACA eligible Medicaid enrollees that it varies from one year to the next. And so currently it is not at 95%. So you'll again see some variances with regards to that on the data that you submit and the payments that you guys get back from us. Yes, sir.
So whether they're ACA or non-ACA, is that something that we're going to know in the billing information, or is that something that your office is going to know?
We know that.
Okay. So we won't know necessarily from our payer mix.
You're not going to change anything that you're currently doing other than adding that extra line and filling out the cost report. And then what we have set up in the system will let us know based on each individual Medicaid enrollee's benefit package where they fall. Are they ACA or non-ACA? And that will determine how the reimbursement is laid out. we have that already built into our system.
So from a fiscal planning perspective, as we're projecting, is there a way to, by zip code, know how many ACA versus non-ACA Medicaid?
Not that I'm aware of.
Okay, thank
Abby,
you.
do you know of anything?
No, because it's based on income and eligibility. It's not based on geographic in any way. So what I would probably say is if you, 50% is the majority. So it's kind of, you know, if you base it on 50, if you get more, great. I don't know exactly how your budget planning process works, but if I'm doing my checkbook, that's what I would do.
And before we move forward, I just want to let you know or remind you guys that since Obama's no longer in office, we have new federal administration, that all of this is subject to change. So, and again, if it does, I will be letting you know.
Will you tweet that?
I definitely will not be tweeting that. So these next couple of slides are just, again, examples. So this is what the non-ACA payment calculation box looks like. Again, I'm not telling you how to fill out your cost reports. I just kind of wanted to give you guys visuals. If any of you are like me, you need to see it. So giving you a screenshot of what that's going to look like, where you're going to put what, so that you can kind of get an idea of where you're going to be reimbursed. So this is a non-ACA, so again, this would be at the 50%, which, like Abby said, is basically the norm. And then this next slide is for ACA, and from year to year, that percentage will be different. So currently, again, it's 95%. Yes, ma'am.
On the ACA piece too, I don't know if you noticed it, but there's been a lot of talk about fiscal year and calendar year. The thing to notice about ACA is calendar year, even though federal fiscal year is different from state fiscal year. And so since our service period year, the year we're using for this program, does cross that, in your settlements, you might see a chunk of them have a 95% federal payment, and then the next chunk have 94%, for example. So calendar year 2017 is 95% for ACA, and then in calendar year 2018 it goes down to 94%. So just something to keep in mind. There may be multiple calculations on your settlements.
Thank you for that. So, the administrative costs. So all GEMT participating providers must agree as part of their participation that they are going to reimburse HCA for the state share of the administrative costs associated with implementing and managing this program. So someone asked, what does that look like? Well, that could be payroll for the people who are conducting the program over at HCA. That could be postage for mailing alerts out to you guys. That could be system updates that we need to take into consideration. And again, it's going to be based on the number of transports each individual provider performs. So again, the administrative fee for each provider is going to vary. It's not just going to be a flat 10% or a flat $500. The next slide I will go over will actually give you some examples of that so you can see a larger entity versus a smaller entity and what that fee may look like. Do we have any questions before I move forward? Okay. So here are your examples. So we say, for the sake of the example, that HCA's administrative cost for the service period is $100,000. Provider A has done there's actually 8,000 transports were performed statewide. And so provider A, we would take the $100,000, we would divide it by the 8,000 transports that were performed statewide, and we would come up with a cost per transport of $12.50. Provider A performed 500 transports during the service period, so we would multiply $12.50 by that number of transports to get $6,250, and that's what provider A would be responsible for paying HCA for their administrative costs. However, in the second example, numbers haven't changed. Still $100,000 administrative expenses for the year. Still 8,000 transports statewide were conducted. Cost per transport is still $12.50, but provider B only performed 50 transports in that service period. So their fee, administrative fee that they would be reimbursing HCA would be $625. Do we have any questions? Yes, sir. She's coming.
Is this calculated on the number of providers that are actually utilizing GEMT? Will that
Yeah.
have an effect?
Yes.
So the fewer providers that are actually using the program, the cost is likely to go up.
Any other questions?
Is this the only administrative fee? Because I thought there was a percentage.
Yes.
So the original bill included a 20% on the intergovernmental transfers, the IGTs, on the managed care side. With new managed care roles through CMS, that's why you saw a managed care carve-out, because we were not able to implement that portion of the program. So that 20% does not apply.
Any other questions?
One of the questions I would have as a stakeholder, who audits your costs?
The state auditor's office.
Okay.
We're audited just like you guys are. Any other questions? Okay. So this last slide is just some information about resources. Again, we have our GEMT website is up and running, and that web address is there. If you haven't already signed up for our email distribution list, then I would advise you to access that second link there so that you can do so. That's the best way to find out what's going on, any system updates, any process changes, the new billing guides going out, all of that stuff. So access that second one. And if you have any individual provider related questions, you want to see if this is something that's going to work for your entity, or you have some type of gray area agreement that's currently going on in your district, please feel free to use the email address in the third bullet, and that comes directly to me, and I will make sure that I get back to you. Thank you.
Question, Abby?
So Abby, do you know how many people in Washington State are on Medicaid? Because according to my smartphone, some 600,000 Washingtonians were added to Medicaid by the HCA. And so 600,000 is the numerator. What's the denominator? Any idea how many people are on Medicaid total? Because that would help, I think, answer John's question about what proportion of our patients would be getting the 93 or 4% FMAP, FMAP compared to the 50%.
So my section manager is on a call with a conference call right now, and she would have that information more closely. So I don't have that off the top of my head. We can get it from her. She would probably know a little bit more than I would.
Other questions? Okay. Well, we are actually ahead of schedule, what we had predicted to be. I thought we'd have more questions, but we'll get there.